She wakes up in the dark hospital room with a burning pain in her arm. A red line is crawling up from the IV site toward her shoulder. Her skin is hot, and she is shaking with chills. Hours earlier, that line was just a tiny red spot. Now, it is a trail leading straight toward her heart, carrying bacteria that never should have been there at all because simple hygiene steps were rushed, skipped, or ignored. These stories are dramatized, but based on real types of events that can happen in hospitals. They are meant to raise awareness about hygiene mistakes and infections and what we can learn from them. They are not medical advice. Always talk to your own doctor or nurse about your own health and treatment. Maya is 35. She has just had a routine surgery to remove her appendix. The operation went well. The surgeon told her it was simple and that she should be home in a few days. On the ward, days blend together. Nurses take blood pressure, give pain medicine, and check the small bandage over her wound. The hospital is busy. There are not enough staff for the number of patients. People rush from room to room with trays, charts, and phones ringing in their pockets. At first, everything looks fine. The bandage stays clean. Maya walks slowly to the bathroom and back. She imagines going home and getting back to her normal life. One day, a new nurse comes in to change her dressing. Her phone keeps buzzing in her pocket. She has already been called into another room twice. She pulls off the old bandage, puts it on the bedside table, and reaches for new gauze. Her hands hover over Maya's wound, then over the supplies, then back again. In the rush, she forgets one simple thing. She never cleaned her hands after touching the bed rail and curtain. It takes only seconds for invisible bacteria on her fingers to find a new home in Maya's fresh surgical wound. At first, the change is small. The skin around the cut looks a bit more red. Maya feels a little more sore than yesterday, but she thinks, surgery hurts, that's normal. By the next day, the redness has spread. The area is hot and tight. Maya starts to feel feverish and weak. She presses the call button. Another nurse lifts the bandage and sees yellow fluid on the dressing and swollen, angry skin underneath. The air smells wrong. This is not normal healing anymore. In her chart, a new word appears: infection. The doctors order blood tests and a swab of the wound. Soon, the lab report shows what they feared: bacteria that can cause serious infection. Maya needs strong IV antibiotics. Her hospital stay, which was supposed to be 3 days, stretches into 2 weeks. She needs another small procedure to open and clean the wound. She lies in bed, exhausted and frightened, wondering what went wrong. Over time, the redness fades. The wound begins to look cleaner. Her fever comes down, and her strength slowly returns. Maya will heal, but the cost is high. More pain, more fear, more time away from home and work. Her simple surgery turned into weeks of extra treatment. For the hospital, this is just one more case file. For Maya, it is a lesson written in scars that something as basic as hand hygiene is not just a rule on a poster, it is a lifeline. Maya survived her infection. Her story is painful, but she went home. But not all hygiene failures end with recovery. Our next story begins with a simple device meant to help a patient heal and ends with an infection that his body cannot escape. Ethan is 64. He is in the intensive care unit after a serious lung infection. To give him strong medicines and fluids, the team has placed a central line, a long tube that goes into a large vein near his heart. Central lines are powerful tools. They make it easier to treat very sick patients, but they are also a direct highway into the bloodstream. If germs reach that line, they can travel anywhere in the body. For a while, Ethan improves. His oxygen levels get better. He starts sitting up, talking with his family, thinking about going to a regular ward soon. The central line should be checked and cleaned every day. The dressing should be changed using strict, sterile steps. Clean hands, mask, sterile gloves, fresh gauze, careful handling of every connection. But the ICU is busy. Staffing is tight. Small shortcuts appear when people are exhausted. One day, a rushed provider adjusts the line without washing hands properly or putting on new gloves. Another day, a dressing change is delayed. The tape edges start to lift, and the skin underneath looks damp. Tiny breaks in the rules, each one just this once, begin to stack up. One night, Ethan starts to shiver. His temperature climbs. His heart beats faster. He feels a deep, spreading weakness that is different from before. The nurse notices that his central line site looks red and a bit swollen. The dressing is not fully sealed. There is a tender area where the line enters his skin. Blood tests are ordered. Cultures are sent to the lab to see if bacteria are in his bloodstream. On the monitor, his blood pressure starts to fall. The word now written in his file is sepsis, a serious body-wide reaction to infection that can shut down organs if not stopped in time. The team works hard. They remove the central line and place a new one in a cleaner site. They start strong antibiotics. Fluids and medicines are given to support his blood pressure. The lab report comes back. The blood culture and the tip of the removed line grow the same bacteria, organisms that live on skin and equipment when hygiene isn't perfect. They now know that the line, meant to help, has become the doorway for a dangerous infection. Despite treatment, Ethan's organs begin to fail. His kidneys slow down. His lungs struggle again. His heart fights to keep up with the infection racing through his bloodstream. The ICU fills with alarms and hurried voices. Doctors adjust medicines. Nurses check numbers. Everyone tries to pull him back. But sepsis, once it reaches a certain point, is like a fire that has already spread to all rooms of a house. Putting it out becomes harder with every passing minute. In the end, Ethan's heart stops. The resuscitation attempts fail. Another life is lost. Weeks later, a group of staff sit around a table looking at Ethan's case. They see the early notes where the line site looked clean. They see the later notes about redness and loose dressing. They see long shifts, high workloads, and missing signatures on hygiene checklists. They cannot bring Ethan back, but they decide to change the rules. New central line care bundles, stricter daily checks, and a policy that anyone, nurse, doctor, or student, can speak up if they see a break in sterile technique. Our third story is shorter. It shows what can happen when someone refuses to rush past a hygiene step. In a small procedure room, a doctor is about to insert a catheter into a patient's bladder to help them pass urine. It is a common procedure done many times a day in many hospitals. The patient is older and already weak. For them, a simple infection could be very serious. The doctor cleans their hands and puts on gloves. Then their phone buzzes. They step away for a moment, touch the phone, the door handle, and a pen. When they come back, they move to start the procedure with the same gloves still on. A nurse standing nearby notices. She sees the small but important break. Clean gloves are no longer clean once they've touched surfaces in the room. She has a choice: say nothing and let it pass. After all, they are both tired, and this is just a routine procedure, or speak up and risk a tense moment. She takes a breath and chooses the second option. She says quietly but clearly, "We need new gloves and a fresh clean. Those aren't sterile anymore." The doctor pauses, then nods. They remove the gloves, wash hands again, and restart with a clean set and proper disinfecting of the area. The patient never knows about the almost mistake. They get their catheter without problems. They do not develop a urinary infection. Their chart never mentions it. On paper, nothing happened. There is no infection, no lab test, no alarm. But in reality, something very important did happen. Someone noticed a hygiene break and cared enough to stop it. One small sentence, "We need new gloves," may have prevented days of fever, antibiotics, and possible sepsis in a fragile patient. From Maya's infected wound, Ethan's deadly line infection, and the near miss with the reused gloves, clear lessons stand out. Hygiene is not a nice extra. It is the base of safe care. Unwashed hands and dirty equipment move germs from one place to another, even when no one can see them. Every dressing change, every line touch, every catheter insertion is a chance to either block infection or invite it in. Shortcuts like "just this once" can have long, painful consequences for patients who did nothing wrong. Near misses, times when someone catches a lapse before it reaches the patient, are not small or unimportant. They show where the system is weak and where people's courage makes the difference. And patients and families are part of the safety net too. It is okay to ask, "Did you wash your hands? Is that equipment clean? Should you be wearing gloves for this?" Those questions may feel uncomfortable, but they can change what happens next. If you were in a hospital bed and saw someone reach for your line, your wound, or your catheter without cleaning their hands, would you feel ready to say, "Can you please wash your hands first?" Or would you stay silent, hoping they know what they're doing? Sometimes, one small sentence about hygiene, spoken by a nurse, a doctor, or a patient, can be the thin line between simple healing and a life-changing infection.